So with me, I have Dr. Vincent Pedre, and we are going to be chatting about his new book, The GutSMART Protocol. And so Dr. Pedre is the medical director of Pedre Integrative Health and founder of Dr. Pedre Wellness, CEO, founder of Happy Gut Life, has worked as a nutraceutical consultant and spokesperson for NatureMD, and is a functional medicine certified practitioner with a concierge practice in New York City since 2004. So Dr. Pedre believes that the gut is the gateway to excellent wellness, and his newest book, The GutSMART Protocol, featuring a 14-day personalized gut healing plan based on the GutSMART Quiz. This is the culmination of years of research and clinical experience as a functional gut health expert. And thank you so much for joining us, Dr. Pedre.
Hey, thanks for having me. I'm excited to have this conversation with you.
Yeah, same here. And yeah, excited to talk about your new book. And yeah, let's before we talk about your new book, can you give a little bit of your background, how you started doing what you're doing, how you started, you wrote the first book, and what led you to write this newer book?
Yeah, well, for one, the research that has come out on the gut and the gut microbiome has just exploded in the last couple of years since I finished my first book, which is over like 7 to 8 years ago since I finished writing that book. So I really wanted to kind of consolidate all the new knowledge that we have, but also take everything that I've learned, the feedback that I've gotten, and write a new protocol for gut health that really kind of puts together all of my experience with dealing with gut patients and realizing that there's no one size fits all when it comes to gut health, that the approach to healing the gut, especially when it comes to nutrition, has to be personalized. So probably the biggest distinguishing factor between the books, aside from the GutSMART Protocol being a 14-day program versus a 28-day program in Happy Gut, is that the GutSMART Protocol is powered by the GutSMART Quiz, which personalizes the program to the individual based on a score that they receive on the quiz. And the quiz is not just looking at gut health issues, but also what I call gut-related health issues. And I talk about that in the book, like the difference between a gut-centric issue and gut-related health issues, which can happen in all different parts of the body, like the brain, the skin, the lungs, the airway. And I wanted to educate people on the interconnectedness of how gut health is really the foundation of the rest of your health. And so, yeah, I think the update in the research, some of the most recent science, and a personalized protocol, I think not only distinguishes this book from Happy Gut, but also distinguishes it from the majority of the books out there that come out with a prescriptive plan that's a one size fits all. And I don't think that's right for everyone, especially when dealing with gut health issues. And from my experience, treating patients now for over a decade with gut health issues using a functional medicine approach.
Yeah, I agree. And it's funny because one of the questions I had prepared is, is there an ideal diet for optimal gut health? And I guess you kind of already answered that, but no, there's no perfect diet.
There's more that we can dive into because there are several things that we can look at, right? So there was a study done as I was writing the book that was published with Stanford University, where they took a small group of women, and they divided them into two groups. I think it was about 16 women per arm, and they did it for 10 weeks and looked at a high fiber diet versus a high fermented foods diet. And they were looking at some important markers like immune function. So we know that 70% of the immune system is all along the gut lining and is very much controlled by what's happening in the gut. We learned that during the world pandemic, how important the gut was in determining whether people ended up being hospitalized with COVID and how severe of COVID that they got. And so they looked at the differences between them. They also looked at 19 inflammatory markers, so very objective measures that you can take from checking a blood test. And then they also looked at the stool microbiome. So they looked at the diversity of bacteria in the gut and what happened before and after. So they tested before and they tested at the end of the program. And what they found, so even within the personalization, we can make some general assumptions. And what was surprising is if you hear people talk about gut health, you're going to hear like fiber, fiber. It's so important. It's important for the health of the colon. And that's true. And what they found was that fiber was a very powerful immune modulator. So it helped balance. And when we say that, I mean, people are wondering, well, what does immune modulation mean? Well, it means that your immune system is in balance. So it's not working too much, but it's not also underactive. And so what was surprising, though, is you would think by everything that we've learned about fiber and how it gets gobbled up by the bacteria in the gut, and then they produce all these incredible postbiotic nutrients that we know as short chain fatty acids that have effects all over the body, including the brain, that you would think that that's what creates microbial diversity by feeding the microbiome fiber. But it didn't. What increased diversity was a high fermented foods diet. And that was about 2 to 4 servings of ferments per day. And I think even more importantly, what they found is when you increase diversity, that you also lower 19 inflammatory markers. So it lowered inflammation. That was a very surprising finding from the study. Now, it's a small study. It's not a big group of people. I think it has to be repeated in a bigger cohort to see if it remains true. But I think it does lead us in a certain direction. Now, if you take my GutSMART quiz and you score severe in your GutSMART score, then what you're going to find is when you go into the food list that you're not allowed to eat fermented foods. Because when you have severe gut dysfunction, you're not going to be able to tolerate ferments. So it's kind of like, I always think of it like those, the old days when we used transparencies in school and you put one transparency on top of another and your professor was showing on the projector, that you've got to interlay like, okay, we understand, yes, eating a good amount of fermented foods on a weekly basis is good to lower inflammation and to improve microbial diversity. That for anyone who's listening, microbial diversity is the holy grail. The more diverse your microbiome is, the less inflammation, the better your gut barrier is. It's what you want. And the problem is that in our modern world, we are losing diversity starting from very early age. Kids that are exposed to too many rounds of antibiotics unnecessarily for viral infections, even for ear infections, a number of years ago, they reversed that. The standard used to be if a child has an ear infection, you automatically give them an antibiotic. And then they found that you actually don't need to do that unless it's a severe ear infection. And that's the problem, is that we're already getting exposed to antibiotics from an early age, and it's damaging the diversity of the gut microbiome. And there's a theory that the diversity never fully recovers. For me, I was on 20 plus rounds of antibiotics from the age of 10 through my late teenage years. Like, that's extraordinary. And it destroyed my gut microbiome. It led to leaky gut. I developed food sensitivities and my immune system was shot. I just kept getting sick. I was that hypochondriac. I mean, part of the reason I went to medical school was I wanted to biohack how to not get sick. I wanted to understand my body. Little did I know that was going to lead me down this rabbit hole of gut health, gut microbiome, fixing my gut, then working with hundreds of people on their gut health issues and seeing a whole host of health issues improve and get to this point. But just to circle back, we can say fermented foods are good, but it depends on your gut type, which is what I determine using the GutSMART quiz. And then you can figure out, is it okay to incorporate ferments or do you have to wait for some gut healing to happen and then you can start incorporating them?
So from what I understand, ferment, at least according to the study, which, like you said, smaller study, so probably needs to be repeated in a larger setting. But it sounds like fermented foods are superior than fiber when it comes to diversifying the gut microbiome. But if you have certain gastrointestinal disorders, such as maybe SIBO, small intestinal bacterial overgrowth, which a lot of those people have issues with the fermented foods, then yeah, they should avoid fermented foods. But the good thing, it sounds like your quiz will kind of guide them in the direction, just to tell them, okay, now is not the time for the fermented foods.
Yeah,
And
exactly. Because I think what happens sometimes is that the nuances get oversimplified, and you might read an article that says ferments are good for your health, but maybe you have underlying SIBO, you have underlying SIFO, fungal overgrowth, candida. You start eating ferments and you feel horrible. You get more bloated, you get inflamed, you don't feel well, and because it's not the right time. So what I did with my book is try to get through those nuances to help people understand when is the right time to eat and what are the right foods depending on your gut type, or your GutSMART score, as I call it.
yeah, so you mentioned candida. So there's different train of thoughts when it comes to fermented foods. So like if someone has candida overgrowth, do you typically recommend for anyone with candida or SIFO, small intestinal fungal overgrowth, to avoid fermented foods completely?
It depends on the person, because sometimes what I find is that they can have such a powerful die-off from incorporating a fermented food that it's overwhelming and it makes them feel horrible. So that's where you really need to be working with a functional doctor or naturopath who understands how to match things together and the rate, because you might, if you have one of those issues, you might just start with a quarter teaspoon of a ferment and test it out and then slowly increase. And I talk about that because I think in our magic bullet philosophy in America with pharmaceutical driven medicine, you hear something and you think, well, if a little's a lot, then a little is good, then a lot is even better. And that's not the case. And I talk about that in my book, GutSMART Protocol, that it's really important to start slow, test the water, and then slowly increase over time. Now, candida treatments can get more complex because when you're killing off candida or yeast, you're going to release toxin. So it's helpful when you're doing that type of treatment to use binders that are going to help bind the toxin and keep it from entering your body. And you can use things like activated charcoal, bentonite clay, but also I personally like, if the person has no objection to them, using SBIs, serum-derived bovine immunoglobulins, because they bind those toxins. And actually, SBIs have been shown to bind endotoxin, other toxins released by bacteria in the gut, which then protects the gut lining and can help the gut lining start to heal. Because inevitably, if you have SIBO, if you have candida overgrowth, if you have dysbiosis, you're also going to have leaky gut. And that's where the problem is, because the leaky gut is like having a leaky, border that's allowing all these inflammatory substances to get into the bloodstream. And they've done tests where they've shown that bacteria and even bacterial DNA gets into the bloodstream. And we know that endotoxin, which is released by bacteria, causes a whole host of inflammatory cascades in the immune system, in the brain, and the liver, and muscle tissue, increases insulin resistance, and then leads to weight gain.
Yeah, it's very interesting what you said about the SBIs. So if someone were to use the SBIs, they wouldn't need like the activated charcoal or bentonite clay, or do you usually recommend a combination?
Sometimes I might use the SBIs by itself, it depends. So, something like that. So if you're working with Practitioner and you're incorporating, you might incorporate different types of binders because they all have different binding properties depending on what you want to bind. But also, SBIs tends to constipate. So if you're working with a patient who's already constipated, then you've got to be really careful with an SBI because you could really stop them up, or you need to make sure that you're going to give them some sort of support so that they're going to the bathroom regularly. Again, it depends on what type of SIBO they have. You want to make sure that they're getting the right amount of fiber, but you have to be careful not to get too much fiber because then it's going to get fermented and they're going to get really gassy, bloated, and uncomfortable.
Okay, makes sense. Going back to the fermented foods, I have two more, hopefully quick questions. So one would be, would you recommend a diversity of different types of fermented foods rather than someone eating sauerkraut every day? And then the second question, do you recommend on top of that a probiotic supplement, or if someone's eating fermented foods daily, would that be sufficient?
Yeah, so in this study, for example, the people who participated in the study were not taking a probiotic supplement. They just added ferment, and it did improve the diversity of the gut. Now, in my clinical practice, when I've worked with patients with severe dysbiosis, with candida overgrowth, sometimes you really need to use a high potency probiotic as well to get in there and help to reset the microbiome. And there's different types of probiotics, like soil-based organisms that are spore-based, that actually produce their own antimicrobial peptides. It's like having little tiny antibiotic creating factories that are delivered specifically to where they're needed, but they're actually not going to kill off your good bacteria, and they're going to increase the diversity of your gut microbiome. So there's a place for that as well. And that's really important. In terms of the types of ferments, I think diversity is kind of like the key to happiness in life, right? So if you start doing the same thing over and over, you're going to get bored with it, and maybe your body's going to get bored with it. So I really think in rotating like the types of sauerkraut, pickles, yogurts. I think for a lot of people, because dairy sensitivity is very high in the population, and even just lactose intolerance is super high. It's probably better to go with like a coconut yogurt or a non-dairy yogurt. But sometimes it can be helpful to use a kefir, for example, that's made from organic milk, grass-fed cows, or even goat milk kefir. But again, it depends on your sensitivities and what's going on in your body at the time. I've personally used kefir as a way to help my gut recover from having had a parasite. So a couple of years, actually, during the pandemic, I went to Guatemala and I ended up getting Giardia. And I was really sick, really, really sick, to the point that it became really hard to eat. And the two things that helped me recover were kefir and bone broth. And it seems strange, and I can't explain why I thought, so usually, and of course, I also took a probiotic, but intuitively, it felt like that's what my gut needed at the time. And that's something that I know it's kind of hard. Like, how do you know? How do you doctor yourself? I talk about that in my book, like intuitive eating and really understanding like before you eat, before meal intuition, during meal intuition, and after meal intuition. And it's very important to understand, before you eat, how hungry are you? And intuitively, what is your body craving? Because there's an intelligence there. Your body is going to let you know. I mean, over the last 20 years as a doctor, like I've had, for example, women come in who eat very little red meat and then might say, my body is craving red meat for some reason. Now, if you're going to go and eat red meat, of course, eat grass-fed beef or eat bison or lamb, very humanely sourced meats. But there is a wisdom there. So usually if that's happening, there's iron deficiency and the body knows. But it could be that you're craving a big bowl of vegetables. Now, if you have severe gut dysfunction, then it's going to be hard for you to digest non-cooked vegetables. Raw vegetables are going to be really hard, especially if you've got leaky gut. You might have pancreatic insufficiency. It's going to be really hard to break down vegetables. You might see vegetable, like if you see a salad green in your poop, then automatically you can assume you've got some element of leaky gut. You're not digesting your vegetables properly. You're probably not making enough enzyme. So you've got to kind of revamp your diet. So sorry, I took your question. I just went on a whole tangent on intuitive eating, but I think it's important because even when you're incorporating ferments, and in my book, I talk about starting at a quarter teaspoon, then going to half. And again, a lot of it is dependent on the person listening to their body. And the one thing I've learned over the years from working with patients is that for some reason, people don't know how to listen to their bodies. They're just not listening to the signals. So sometimes I used to think like I'm just a body whisperer. I'm just telling people what their bodies are telling them and helping them learn how to listen to their body. And that's why it's so important to have that after meal intuition where you're kind of, you're tuning into your body and saying, okay, I ate this meal. Now I feel really sleepy. I feel tired. I feel bloated. I'm not feeling so great. So I had a professor I listened to give a lecture, and he said we should be eating for our microbiome. But I also like to think that I eat based on how I want to feel and the time of day, because there is a circadian rhythm to what your gut is doing and to how your body is going to respond to different types of food.
So leaky gut, you mentioned leaky gut a couple of times. So I definitely want to cover this because there is, especially when it comes to testing, like I used to do testing all the time for leaky gut, and then I just saw most people were positive. So I assumed people have a leaky gut, and that's what I do these days. A lot of practitioners do that, but some still do testing. Maybe your quiz kind of points them in the direction of whether they have a leaky gut. But so I wanted to get your approach.
If you end up with moderate or severe dysfunction, you pretty much can ensure you've got a leaky gut in the background. And I agree with you. The testing for leaky gut is not foolproof. Like the lactulose mannitol tests that can be used for leaky gut, but it's really only picking up leaky gut in the small intestine. If the gut is leaky in the large intestine, it's not going to pick that up. It's much harder to pick up. And for example, patients with Parkinson's disease tend to have increased intestinal permeability or leaky gut more in the large intestine than the small intestine. So yeah, I did the testing for a while. Sometimes I do food sensitivity testing. And if someone lights up across the board, like lots of high sensitivity, moderate sensitivity reactions, you can assume they have leaky gut. If I do wheat metabolite testing, so looking at different wheat breakdown proteins and metabolites, and then look at antibodies to zonulin, as well as antibodies to actin or vinculin, which are basically cytoskeletal structures that hold the cell together and help create those tight junctions between the cells. You can assume that if you've developed antibodies to those structures, that you've got leaky gut. So that's another, it's kind of like we're working like Play-Doh. We're looking at the shadows against the wall. We can't exactly measure it directly. I mean, you could put somebody under an they have ultrasonic endoscopy where they can do micro ultrasound and look at the gut lining. But we're not going to do an invasive procedure on every patient that we suspect has leaky gut. Right. And just like you, after testing for a while and seeing how people even just react to putting them on a leaky gut protocol, I just decided I'm just going to go by the clinical, because it's very obvious who has leaky gut and who doesn't have leaky gut and how they respond to these interventions.
Yeah, it sounds like the test you use is similar to, I'm sure you're familiar with Cyrix Labs, because that's what I used to use
Yeah,
the labs
Cyrix
for.
does that. Vibrant America also looks at wheat metabolites, food sensitivities, dairy metabolites. And yeah, the thing is that um, it's like you're building the evidence, and it's nice to have data. I'm very much into collecting data on patients, but there's a point where the data is not perfect anymore, right? And I know there are labs that are looking at stool PCR patterns, so microbial patterns that might be indicative of increased intestinal permeability or leaky gut. But even that, I think we still don't 100% know. We're just making assumptions. I think as
Yeah,
we get more pooled data from more stool analysis and start seeing, you know, what patients with leaky gut, what their microbial makeup looks like, maybe we'll start seeing a microbial signature that identifies leaky gut. But we also know that there are different microbial signatures, even depending on what part of the world you live in and what your diet is like.
and another flaw of the test, they don't tell you what's causing a leaky gut. Is it because you're eating gluten on a daily basis? Do you have a gut infection, or is there another factor that's causing a leaky
So,
gut?
absolutely, and I know you had a question about that, about gut pathogens and infections, and the thing is that when you find them, I think it's important, depending on the pathogen and whether you always have to line up the test result with the story of the patient. So if we're interlaying those transparencies, I hate medicine where you just treat the test result and you're not taking into account the person. You've got to overlay, okay, we have this test result. Does it make sense with what's happening with the person, with the story, with the symptoms, with how they're presenting? And if it does, then you treat. I think we have to be really careful about being trigger happy and treating everything that appears on a piece of paper, because sometimes it doesn't quite honestly correlate with what's going on with a person. Some people may be able to tolerate having certain imbalances better than others, so.
So I don't know the answer to this what your answer to this question will be, but I kind of think I do based on what you just said. So there are some practitioners that will treat everybody for parasites, and I've even interviewed people that do that. So it sounds like that wouldn't be your approach, because again, that's like the
Yeah, it
same.
depends. I'm going to say it depends on the parasite. For example, Blastocystis hominis, one of the most common parasites worldwide. Very common in India, but actually it's found in the United States. I've picked it up in patients many times. And if you do a Google search, you'll find like literature saying it's a benign parasite. You don't need to treat it, like ignore it. But if you dig a little deeper, you'll find research studies connecting Blastocystis hominis with leaky gut. And we know that leaky gut is the first step down a chain reaction that increases inflammation, overactivates the immune system, can eventually lead to autoimmune disease and the rest of all chronic degenerative disease in the body. So I think always putting it in context of that and who the patient is and figuring out what is the right thing for that person. If they have amoeba in their stool, of course I'm going to treat that because it's incredibly inflammatory, it's invasive. If they have any other sorts of parasites, yeah. So I tend to err unless there is evidence that the person is not showing any signs of any issues, including blood markers, not having elevated C-reactive protein, other things that are important. But I think something like H. pylori, for example, is a great example of a pathogen, quote unquote, that infects the majority of the people in the world. And when they first found it, they connected it to peptic ulcer disease. And they said, oh my gosh, like if somebody has H. pylori, we need to treat H. pylori. And then of course the pharmaceutical industry is all on top of that, coming out with all sorts of regimens, including clindamycin, which is one of the worst antibiotics you could ever take because it increases your risk for C. diff diarrhea, which is a very bad diarrhea that can even lead to what we call megacolon, and could even, at worst case scenario, it can lead to death or a ruptured colon. And you're increasing the risk of that by going on these antibiotics for H. pylori. We know there's also increasing antibiotic resistance. But the fact is that that's an example where, say you find H. pylori in a person, it could be just a colonizer. Is it an active infection? It depends on the way that it was tested. And then is the patient symptomatic? And if you do an endoscopy, do they have an ulcer, or do they have metaplasia, like signs of precancerous changes in the stomach, which can be caused by H. pylori? And if they don't have that, you probably shouldn't treat the H. pylori because it may be serving a certain purpose in there. And again, taking into account the risk-benefit ratio of putting the person on this crazy 2 antibiotic regimen plus a proton pump inhibitor, which then can lead to SIBO, to all sorts of other problems, which I have seen, yeast overgrowth. So it depends on the situation, the person's particular individual case, and what they might be at risk for, or maybe the other underlying issues that they have at the same time.
Yeah, that's pretty interesting. Would you agree that in some cases, H. pylori, well, actually, you kind of answered this. So H. pylori doesn't always cause symptoms. So obviously, again, if someone has, if they have ulcers or, reflux, that might be an indication to treat H. pylori. How about if they have an autoimmune condition in the presence of H. pylori, but no symptoms? So it sounds like even in that case, you might not decide to treat them just because they have an autoimmune condition.
Well, yes. And you have to think the treatment itself is putting them at risk for developing a severe dysbiosis, leaky gut, which is only going to aggravate the immune system and possibly make their autoimmune condition worse.
Yeah, and I agree with the antibiotics. I guess I should have mentioned, like, if taking an herbal approach, for example, for H.
Like an herbal approach. Yeah, the herbal approaches, I've seen and used different herbal approaches, and they're not incredibly successful. I'd say that we're at 50% successful with people.
I would agree.
So again, if a person has it, then I think you have to be judicious about deciding, like, is this something that we should treat? Or is it, okay, we found it, but let's, instead of treating it because you have no symptoms, let's work on improving your microbial diversity through the diet. Let's improve gut permeability. So let's reduce leaky gut. Let's reduce inflammation in the body. So let's work on it from a different angle rather than attacking. We want to rebuild the gut and the immune system.
So there are a lot of practitioners who will treat parasites. Again, no stool test, no symptoms. They just assume everybody has parasites and they treat for it. So again, it sounds like similar to H. pylori. You wouldn't treat for parasites unless if they have a finding on a stool test, or, there is a possibility of false negative. So maybe they have a false negative, but they have symptoms that are indicating they have a parasite.
It's a bit of a rabbit hole, because if you start investigating, probably most of us have some sort of parasite, right? We could have a worm, parasite, and parasites might actually serve an immunomodulatory purpose in the body. If you look at India, where people are colonized with parasites, India, before they started introducing more antibiotics and more of a westernized processed foods diet, India had very low rates of autoimmune disease. And if you track what's happening in India throughout the 1900s, as antibiotics are introduced, more of a westernized sugar, processed foods type diet, you start seeing autoimmune disease start rising in India. So that might be an example where having some level of parasites in the gut actually serves a favorable, it's part of microbial diversity. The other thing that I would say about it is, if you don't know what the parasite is, how do you know that your treatment is correct? And to make it even more complicated, we have all these tests, the stool PCR, stool culture. Some of these tests are really poor at detecting parasites, especially if it's like a culture. PCR maybe will detect the parasite, not always. I think it's great when you find one. Whenever I've found a very specific parasite and I can do a targeted treatment for that patient, patients always improved in some way, whether it's their energy improved, joint aches they were having that other doctors thought were due to an autoimmune disease improve. So when you find a parasite and can do a targeted treatment that you're treating exactly what you have, that's very helpful. I have a friend doctor that sends stool samples to Africa to a lab in Nigeria, where it gets analyzed under microscopy, and they find parasites that are missed by other labs. So again, the question is, are we using the right testing to look for these parasites? And does the patient's symptoms correlate with a parasitic illness? So on one side, you could say, okay, yeah, you could assume people have parasites. It might not be a bad thing to do a parasite cleanse. Might actually clear you up. But if you do that and you don't feel better, then maybe the treatment didn't kill off the parasite. Maybe it was the wrong parasite. Maybe it was the wrong treatment. Maybe it wasn't for long enough. So like anything in medicine, there's never a black and white, like, yeah, do this, don't do that. I think it's a matter of understanding each individual case.
And on a stool test, if you see some opportunistic bacteria, like again, commonly you'll see Staphylococcus, Streptococcus, Klebsiella, Pseudomonas. Do those are those usually not a concern, or is that something you usually address?
Yeah, it totally depends on the full clinical scenario, what's going on with the patient. But I think, let me qualify by saying that I've become, over the years that I've been taking care of gut patients, I went from being much more aggressive to being much gentler in my approach. So now if I see that, I might say, okay, let's build up the gut. Let's work on leaky gut. Let's work on microbial diversity. Let's use a spore-based organism that's going to go in there and it's going to go fight and claim territory away from these pathogens. But let's approach it from a different direction. And that's kind of where I'm at now, is being gentler with people and having an approach that maybe is a little bit slower, but long-term, it actually works better for them.
Makes sense. Yeah, I agree. You don't want to be aggressive with everybody. There's a time and place, but treat everybody who has increased Staphylococcus or Streptococcus, especially if they're not having any symptoms.
I think also, certain things we do understand, like say you have an E. coli infection and you have Campylobacter, it's going to give you massive diarrhea. You're going to feel horrible. And I think because of those situations, sometimes we apply that reductionist thinking to all these fancy stool tests that we can get, whole genome sequencing. But what we don't understand is when you find that in a patient who's not having acute diarrhea or any other acute findings, what is it actually doing in the balance of the entire microbiome? Is its presence pathological, or is its presence part of the normal background and all you need to do is just do a little tweaking to improve it? And I think that's kind of where I'm at more now, is about restoring gut microbiome diversity and letting the gut rebalance itself, rather than thinking, I just seen people treat people with strep or staph and all that. And sometimes it goes well and sometimes it actually creates more problems.
All right. Well, thanks for sharing that. And I have one more question. I can't let you go without asking about gluten. I assume you have people avoid gluten, but I also heard on another podcast you were talking about, why some people avoid gluten. They might not have had issues with gluten, but then they avoid it and reintroduce it, and all of a sudden they're reacting to gluten, or maybe it's a different food. But yeah,
Yeah.
what if you could expand on that?
Yeah, totally. I mean, gluten is one of the most inflammatory substances. It's been found to trigger a molecule called zonulin that's found inside the cells that line the intestine that controls gut permeability, kind of like a dimmer switch. So they've looked at gluten and its effect on people with celiac disease, people with what we call non-celiac gluten sensitivity, and normal individuals. And they found that depending on the degree of disease, gluten is going to have increasing effects on the person, but it is not neutral for a normal person. So even for someone who's normal, it's going to cause a slight increase in gut permeability. And so what might be going on, because we know that, I don't know if you've gotten into this in other podcasts, but how wheat has been hybridized, and the gluten content in the wheat, especially here in the US, is 30 to 50% greater than it was 50 years ago. So we're being exposed to gluten at a much higher rate than our digestive system can handle. It's a very difficult molecule to digest and break down. So if you have leaky gut and you have gluten and you've got partially digested gluten molecules that then get bound to an enzyme called tissue transglutaminase, then you get these chimeric molecules that your immune system is going to look at and say, this is foreign. And then it has a molecular mimicry that then can cause your body to attack things like your thyroid, for example. So I think it's a stepwise hit problem. So maybe you start off normal, but then you go on antibiotics, your gut permeability maybe increases a bit, and you're eating a lot of bread, pastries, things like that. Diet's not perfect. And I think there's an accumulation over life issue that eventually you can reach that threshold where it causes disease in the body. And that's the same theory for all disease in the body. I think we need to apply that also to gluten. Why is it that maybe during your 40s you were not gluten sensitive, but in your 50s now you're starting to find that you don't feel so good when you eat gluten? Maybe you get achy, maybe you get mental fog, and I think it's that multi-hit hypothesis over time. It could be genetics, genetic expression that changes over time. Our genes are controlled epigenetically by the foods that we eat. And I think that's a dynamic process. It's not something that's just set in stone. We used to learn that celiac disease was a disease that was diagnosed early in life in pediatrics. And we learned about celiac in medical school. And this was only 20 plus years ago for me, in our pediatric rotation. Now we know that celiac disease could evolve later in life. So you might have the predisposing genetics, but then it's just the multi-hit exposure after exposure after exposure to gluten that eventually just cracks the camel's back, and then you get celiac disease. So my oldest patient with celiac disease, who also had Hashimoto's, which is very much linked to celiac, I diagnosed her with celiac at age 52, and she had positive markers. No other doctor had picked it up. But I think also it's because I asked the question and I thought, this is not what I learned in medical school, but what if she has celiac disease? Because she would get sick whenever she ate anything that had wheat, gluten, and she would get nauseous. And so I think we have to have a really broader understanding of how disease evolves over a lifetime, and that even if you were fine when you were younger, what I like to tell people is that your body is like a board game that changes the rules, but it doesn't tell you that the rules have changed. You have to find out that the rules have changed by playing the game. So you kind of have to figure it out. And if you can be astute to that and understand that your body, your blueprint is slightly changing as you get older, your body's going to be a a stronger read of what's going on. So say we find that you're gluten sensitive and you take gluten out of your diet and you create this blank slate. Well, when you were eating a lot of gluten, it was overwhelming your immune system and causing immune complexes that maybe weren't allowing for the full expression of the effects that gluten was having in the body. And then, for example, you mentioned that one patient where she had taken gluten out, she felt better, she was feeling great. Then a month in, she went to out for a pasta dinner or something, and she broke out in full body hives. And she was upset. She's wondering what happened. Did I make myself gluten sensitive by taking gluten out of the diet? That's not what happened. What happened was you created a blank slate. So when you reintroduce gluten, now your body's going to give you a very clear read of what that gluten is doing to you. And it caused this massive activation of the immune system that led to hives in this person. And I think that's something important for people to understand, that if you take a food out of your diet and do these elimination diets, and probably if you follow my GutSMART protocol and do the protocol for 14 days, then retest, do the quiz and see if you can progress or you're still in the same level. And say you progress from severe to moderate and you can start to introduce new foods into the diet. I still tell people, there's still a powerful individuality that goes into what your body can tolerate. So even though I've determined like these are the foods that are okay under the moderate, I still want you to be intuitive and listen to your body, because what might be right for one person might not be right for everyone.
All right. Well, thank you. Thank you for talking about that. And yeah, definitely agree. And where can people find out more about you? I know you have a free gift as well, so I'll let you take over and yeah, just let us know where we can get your book.
For all your listeners, I'd love to share a free chapter and some special surprise bonuses from my book. If you go to gutsmartprotocol.com/gift, and I know you'll put that in the show notes. And if you want to learn more, go to gutsmartprotocol.com. You can learn more about the protocol and the benefits of doing it, and what people have found from following my protocol.
All right. Awesome. Thank you so much for your time, Dr. Pedre. Appreciate it. Learned a lot, and I'm sure the listeners did as well.
Thank you. It's great being here.